Hello, my name is Sammy Jo Wilkinson. I'm going to talk to you about the patient perspective on cellular therapies. Thank you all for attending and presenting at the inaugural conference for AACT, titled The Dilemma of Difficult Diseases, Cellular Therapies to the Rescue. I sure hope so. And a special thank you to those who have traveled a long way from other countries. Thank you also to the founders, Dr. Mark Holterman and Kathy Hebert, for founding ACT with a focus on accelerating patient access to cellular therapies as safety and efficacy continue to mount. Today I will tell you about my role with ACT, my positive personal experience with stem cell therapy for multiple sclerosis, and what the patient community wants to see happen with cellular medicine. I am honored the ACT board has elected me to serve as Patient Advisory Board Chair, and I welcome the opportunity ACT has given me to highlight the plight of both acute and chronic patients that could be helped by cellular therapy. We should not have to pursue this as medical tourists. My experience: I've had MS since 1995 when I was 30 years old and just starting a .com business in the financial publishing area. This disease has no known cause, no cure, and the approved disease-modifying drugs only offer to slow the disease progression, but with a heavy side effect profile. I tried these approved drugs. They all failed me. In 2002, I was told my only hope was Novantrone chemotherapy, which carried the lifelong risk of heart failure and leukemia. It did not do anything to slow my disease. It damaged my heart and veins, and I started using a cane while I was on the drug and became too disabled to continue working. A decade later, in about 2011, I'm in a wheelchair, suffering from over 28 symptoms, and I'm looking at nursing homes because I'm becoming so paralyzed. I've always followed cell research because I kept hearing from MS patients who found relief at foreign clinics. Then I heard about Celtex Therapeutics in Houston, Texas. They used one's own adipose-derived stem cells. Celtex also offered lifetime banking, so I only had to do a one-time mini liposuction for the extraction, and then they're kept forever in cryo-freezing. When a dose is needed, only pure mesenchymal stem cells are expanded in the lab to a therapeutic dose, similar to the higher dosing I was seeing the university clinical trials using. Each batch is fresh, not frozen. Exhaustive safety tests are run, including karyotyping and SMP tests, to ensure no genetic changes have occurred during multiplication. In May of 2012, I spent 3 weeks in Houston receiving a weekly IV of 200 million of my own mesenchymal stem cells. My response was very positive and very immediately. Feeling returned to my hands. I could feel my fingerprints again. My heat tolerance was regained. My energy levels soared. The stiffness abated. So my husband and I were able to enjoy touring for the first time in many years. We went to NASA and saw the space shuttle. We went to the beaches in Galveston. We saw alligators in the bayous, and we went through every art museum in Houston. It was just amazing. This protocol is designed to put the immune system back into homeostasis with the first large dose, but it could also require repeat booster IVs of 200 million to sustain the remission, especially in the case of aggressive and long-standing disease like I had. I had a great summer, but I could feel these effects were fading at 6 months and scheduled the next treatment for October 2012. Then disaster struck. The FDA blocked access to using one's own stem cells in September 2012. This was despite the heroic efforts of Dr. Chris Centeno and his lawyer Andrew Ittleman in the court case of United States versus Regenexx Sciences. This delayed my therapy plan, but Celtex found a top-notch certified hospital in Cancun, Mexico. Under regulations established by both the FDA and COFEPRIS, the Mexican equivalent, they were able to export and import cells. I was able to resume treatment, but the extra costs and health risks associated with a 14-hour day of international travel is an extra burden patients should not have to bear. And all of this just for a 1-hour IV that I should be able to get in my local doctor's office. Without the tireless support of my husband of 33 years, I would not have been able to access this therapy. Happily, he has also benefited from stem cell therapy. He's no longer suffering from inflammatory arthritis that was disfiguring his joints and very painful in his hands. And he also had a hip injection and was able to ward off having a hip replacement. His mobility is completely returned and his health is greatly improved. Now, after my 4th treatment in May of 2014, I can only describe my state as long-term remission from secondary progressive MS. I don't know how long this will last for, but I'm very happy with it. And my health is improving, and so is my function. I can sit outside every day in 80-degree sunshine, and the heat doesn't bother me. I don't feel sick and miserable anymore. I have enough energy to exercise every day. Of those 28 symptoms I started with in 2012, 13 are completely gone, at about 46%, and the remainder are improved. But I'm still in a wheelchair. This may be like post-polio syndrome, where the stem cells simply can't repair tissue that's been destroyed, like my atrophied spinal cord. However, with exercise, I have been making steady progress this past year. I no longer need assistance to get in and out of bed or shower. Now here's an action shot to show you what I'm talking about. Here is a demonstration. There still may be a chance for me to walk again. Normally, I am an 8.0 on the disability scale, which means I can stand up, but my feet won't move. Since stem cells, about 1 to 2 times a month, I can walk with support, especially if I take a big dose of niacin and turn beet red. This puts me at 7.5 on the disability scale. A great comfort, because if you reach a score of 10, you're dead. Talk about exercise motivation. So I've just taken you on my personal tour of the future of regenerative medicine. Do you want to wait 5 to 10 years for this? Let's not. Why don't we all leave this conference with a commitment to make this happen faster? The time for change is now. Limitations in existing techniques are frustrating both doctors and patients. Alan Roses, remember this one? CEO of GlaxoSmithKline, famously admitted more than 90% of drugs only work in 30 to 50% of people. It is time for the next shift to regenerative medicine. Article 35 of the Declaration of Helsinki guarantees patients the right to seek compassionate access to experimental therapies if all else has failed. This is an inalienable right, not something to be given at whim of governments. The will of the people supports accelerated access to breakthrough therapies, evidenced by the unanimous approval of right-to-try laws sweeping across the U.S. And congratulations, Illinois, for being the 25th state to join this movement. And the 21st Century Cures Act is on a swift passage through Congress. Proposals already exist from leaders in this field on how to accelerate the approval process. Dr. Andrew von Eschenberg, former FDA leader, spelled it out in his Wall Street Journal editorial, quote, "Breakthrough technologies deserve a breakthrough in the way FDA evaluates them. Take regenerative medicine. After proof of concept and safety testing, a product could be approved for marketing with every eligible patient entered in a registry, so the company and the FDA can establish efficacy through post-market studies." Professor Arnold Kaplan, who first discovered mesenchymal stem cells in 1991 and is a distinguished presenter at this conference, has published a detailed roadmap entitled Progressive Approval. Japan has already implemented such mechanisms in the Regenerative Medicine Act of 2014. It's time for the U.S. to move forward with cellular therapies. Faster access to cellular therapy, especially for no-option patients, needs to be a national priority. The regulators need to work with us, not against us. And what could this mean for society to improve care? The savings in health care and disability costs will more than offset the greater costs of living longer. Yes, the mouse studies are telling us lifespans are extended by cellular therapies, but that's a whole nother conference agenda for the future. Right now, we just need to focus on the millions whose suffering could be alleviated. If you have any interest in accelerating access to cellular therapy, please become a member of AACT. Patients, caregivers, doctors, researchers, regulators, we all have a role to play in making this happen. Thank you so much.